Welcome to Let's Talk Tuesday, a podcast about all things virtual care from one of the first innovators in the category, Let's Talk Interactive. Today, we're diving into telehealth and virtual care trends. Over the last 3 years, telehealth has gone from an almost unheard of care method to a highly utilized and life-saving solution. And it's certainly not going away anytime soon. A recent class report indicated that patients are demanding more digital health tools that allow them to manage their care, and digital access tools, like patient portals, online scheduling, and virtual conferencing, are a central priority when selecting a care facility. Telehealth in 2022 is proving to be the year that it becomes so much more. One trend we're seeing take shape in many sectors is remote patient monitoring, also known as RPM. Remote patient monitoring is a method of healthcare delivery that uses the latest advances in information technology to gather patient data outside of traditional healthcare settings. It's about moving more healthcare out of the traditional setting and into the house and where people live, work, and play. And it's about using technologies to build the bridge between the traditional physical setting of healthcare and where people are in their everyday lives. In 2020 alone, the use of remote patient monitoring grew by triple digits, and it's expected to continue to grow. Remote patient monitoring through the use of devices such as blood pressure monitors, blood glucose monitors, or weight monitors blends the use of technology into a continuous need for practitioners. These wearable monitors provide instant, real-time data that providers have immediate access to no matter the location of the patient. Beyond RPM, we're also seeing new models of telehealth. Pre-pandemic, practitioners were able to provide care for patients via telehealth if they had a license to use the platform. Hospitals and other care organizations had to purchase licenses for each of their providers. But this approach was getting costly, so some organizations chose not to pay for licenses for all of their providers. This amplified a barrier to care. There are physicians who are capable of providing virtual care, but they can't because they don't have a license to use telehealth. So some patients were waiting months to be seen because of this. Companies are hearing about this challenge and thinking how to shift this model to create more access to care. Let's Talk Interactive, for example, has innovated a solution that reduces these limitations for providers and patients. Let's Talk Interactive's new enterprise platform is utilization-driven. The platform usage is based on telehealth sessions performed, not licenses. Any provider at a healthcare system can see a patient, not just those with licenses to use the platform, which equates to improved access to care. In addition to utilization, more and more companies want to jump on board with improving access to care by implementing a consumer-friendly virtual care method that benefits everyone. Companies well outside the health sector, like technology and retail giants, are taking a look at telehealth and figuring out how they can apply it to their business. These companies and their designated payers are launching new care models frequently. While Amazon, Walmart, Teladoc, Best Buy, and CVS have done this already, expect more to launch telehealth services in 2022. Another area of innovation in virtual care is AI and robotic process automation. These are cost-effective ways for providers to complete essential tasks. Things like automation of appointment scheduling, administration, and data management are all ways AI is gaining popularity. The benefit from digitizing day-to-day processes is more time goes to focusing on patient care. An extension of AI trends in healthcare is cognitive automation, which acts as the brain behind healthcare organizations. This IT trend can help automation capabilities and machine learning algorithms within the healthcare field. While they are not widely accessible today, this will be something to watch in 2022 as it continues to be offered to many more organizations within the healthcare scope. Lastly, a care model that is growing is hospital at home, which is expanding all across the nation right now. Hospitals are even getting waivers to offer telehealth services. Remote integration will follow in line with the rise of at-home care as well in 2022. Specialists can evaluate patients through augmented or virtual reality, in addition to the traditional use of synchronous video conferencing via secure telehealth platforms. It's safe to say the impact of telehealth innovation on the healthcare industry will continue to grow. Organizations must determine a way to incorporate telehealth and develop a virtual front door now, if they haven't already. If you're ready to get started on building a virtual extension of your business, the experienced team at Let's Talk Interactive can support you. Contact LTI today to get started.